Hi everyone, my name is Sydney Flatt and I'm a second-year medical student here at Queen's. My project was an evaluation of the Maternal Health Clinic, which is also known as the MHC. The MHC is a cardiovascular disease prevention clinic where women with a pregnancy affected by certain complications are seen for a 6-month postpartum follow-up appointment. These clinic appointments focus on lifestyle modification, future pregnancy counseling, including low-dose aspirin prophylaxis for those with a hypertensive disorder of pregnancy impacting their index pregnancy, early glucose testing for those with gestational diabetes impacting their index pregnancy, as well as pharmacotherapy recommendations and referrals to other healthcare professionals. So the objective of my project was to determine whether patients who attended an MHC appointment following a pregnancy complicated by gestational diabetes or a hypertensive disorder of pregnancy have improved interpregnancy and subsequent pregnancy outcomes compared to women who did not attend. So we conducted a retrospective cohort study on all pregnancies over 20 weeks gestation who delivered at KHSC between April 2010 and December 2019. And this included a treatment group of 178 patients who attended the MHC and a control group of 133 patients who did not. We excluded any women who attended the MHC for a complication other than gestational diabetes or a hypertensive disorder of pregnancy, and also excluded any stillbirths, as it's likely that they already received very similar counseling and follow-up from maternal fetal medicine. So moving on to the results, the first significant finding was that patients who attended the clinic had improvements in interpregnancy weight reduction compared to women who did not attend the clinic, with the MHC cohort entering their subsequent pregnancy an average of 1.47 kilograms per meter squared lighter than the control cohort. And this was significant even when multiple variables were controlled for. The second significant finding is that patients who attended the clinic also had fewer interpregnancy type 2 diabetes diagnoses. And the magnitude of this effect was that 0% of patients who attended the clinic compared to 7.9% who did not attend the clinic developed type 2 diabetes between pregnancies. And then finally, when assessing for the median gestational age at the subsequent delivery, we determined that patients who attended the clinic had an average gestational age at delivery of 39 weeks compared to 38 weeks for those who did not attend the clinic. And while that seems like a small difference, research is beginning to demonstrate an association with developmental advantages. We found no significant difference in subsequent pregnancy complication recurrence rate of either gestational diabetes or a hypertensive disorder of pregnancy. However, a post-hoc power analysis did reveal that the study was unfortunately not adequately powered to answer this question. So we believe that these results support the continued development of these clinics that are based on the MHC model. Thank you for listening, and I'm happy to take any questions.